All right, welcome, Mountain Mamas, to our Zoom training today. We're going to be doing, the first section is going to be medical common injuries. That's our first aid skill today. This is going to be like a fire hose. I'm so sorry already. I'm a nurse and I've got a lot of, sorry, we have a cat. We have there's just a million things that can go wrong, but we're going to focus today on just the simple things that should have simple solutions. So first thing we're going to talk about is blisters. Blisters, we get them all the time. They're those warm spots. Obviously, the first thing you want to do if you start getting a warm spot is stop. We never do, but you should. And some things that you can do is the old school moleskin, but I prefer to use even duct tape or medical tape if you can get on that spot right away and keep it from getting more rubbed or anything like that. And then if it starts to rub and has become an open blister, you actually want to drain it if it's in a place where you have friction, where you know it's going to rub on it and peel it off. If it's on a hand, like you got a scald or something like that, and it's, maybe not on a hand, because hands and feet, you both have places where they can rub off. But if it's like on an arm or something, it's actually best to just kind of keep that blister there and put on a dressing or bandage and just keep it from rupturing, because the blister itself keeps a good bandage on there. But if it's on your hands, your feet, we've got to drain that bugger because otherwise it's gonna peel off and be nasty. So the best way to do that, of course, is to clean the area first with whatever clean water you have. And then we want to pop it. I usually use a needle. I carry that just like a safety pin or a sewing needle. And you sterilize it with some a lighter and just poke that little edge, drain it out, all the goo, and then just cover it with a dressing. If it's in an area that you're going to keep using, you want to put something on it to keep it from rubbing. So if you do have some sort of thicker moleskin or something like that, and they say to cut it in a circle, but I recommend actually using a C shape so you can get blood flow into that area, and just putting that little foam C on the top of the bandage. So the bandage is on there, it's protecting it. You can also put it, I've had situations where you put that on first and then put the dressing on top of that. It works, but you still have some drainage and stuff like that can get on it. So anyway, those are your blisters. FYI, all this is on an outline that's on the Facebook page. If you want to download it, it's all there. So don't worry about frantically taking notes if you want to. The prevention for blisters, I like to use a thin sock along with a thick sock if you're having issues of rubbing. Of course, if you've got new boots and the shoes, you're always going to have issues. But like even something thin like a nylon, like a knee-high nylon underneath like a thick sock can do wonders for preventing that kind of rubbing. Let's see. And then just take off your boots and your shoes to give them a break when you're not hiking. All right, so that's blisters. Now, number 2 is diarrhea. This is awful. If any of you guys have ever had diarrhea, I've had issues of the high altitude mountains, and we would just take an Imodium just to like quiet it down for the week we were up there. But I don't highly recommend that. That was a desperate situation. But obviously, diarrhea is a big concern. If you're only doing something overnight, it's not such a big deal. But if you're out somewhere for days and days and days, this can be seriously problematic. It can be caused by protozoa, bacteria, viruses. There's 2 different kinds. One's non-invasive, where you have colonies of critters that are in your upper small intestines. They'll cause abdominal cramping, nausea, vomiting, a lot of fluid that's coming out of your body, salt and potassium. You're losing a lot of salt and potassium. So lots of fluid loss. Just think about that. The other kind is invasive bacteria or invasive diarrhea, and that usually is involved by a bacteria that attacks the lower small intestine and colon. It causes inflammation, bloody bowel movements, fever, abdominal cramping, and really painful stools. So your treatment for both of them are going to be, the fact that you're just having dehydration is an issue. So no matter which type you have, you're going to want to treat the dehydration. Now, if it's only a mild case, you just drink a lot of water. You want to do maybe diluted fruit juice or sport drinks that also have, sorry, that's the cats. Awesome. Okay. Sport drinks that replenish your electrolytes. I stay away from the Gatorade just because it's tons of sugar. Propel seems to be a little better. I'm sure all of you guys have your own favorite ones. But if you start having more of a serious case of dehydration, diarrhea, like you're just losing so many fluids. Of course, we would try and evacuate you and get to a hospital, but in the meantime, what we will try and do, there's a cool oral hydration solution that you can do. We've used these even like in third world country situations. Anyone can throw this together. It's 1 teaspoon of salt, 8 teaspoons of sugar, and 1 liter of water. And you mix all that and you try and drink 1/4 of that every hour, just constantly. And just that rehydration is very, very helpful. And it can save lives in really extreme situations. But we definitely want to do that. And then I'll also try and push just regular water along with doing that. And then eating really simple foods. In nursing, we call it brat, B-R-A-T, or brat. Bananas, rice, applesauce, toast. Anything really simple that's not going to hurt your belly is a great thing to kind of just try to get people food along with their, when they're losing fluids. I've been super, super sick and had dehydration and diarrhea like this awful. It's just part of traveling, especially when you're third world countries. It can be miserable. So do focus on your hydration and eating very simple foods and try and keeping things down. It can help with a ton of more. This just can be very, very dangerous if it gets out of hand. If you're, as far as medications, the non-invasive kind, where you're just having lots of watery diarrhea, you can use Imodium or Lamodal, which is fine. The trick is, if you do not know the difference, if you don't know if you have non-invasive or invasive, you're just having diarrhea and you're not quite sure, then you just have to be careful about taking Imodium, because if you are plugging up something that's infectious, if you have an infection, your body's trying to get it out, and you stop it, it keeps that infection in there. So you have to be really, really careful. I would say, just be really cautious when using Imodium if you don't know the cause of your severe, watery, painful diarrhea. You want to just get to a doctor. If it's the invasive kind, the only way to treat it is with antibiotics. So just watch out for that. Okay. And then of course we want to evacuate. Sorry, this one's exciting with animals. All right. Our third item today is dehydration. This can, of course, be caused by sweating, urination, just breathing. And of course, we talked about diarrhea. A mild case of dehydration, you're going to have loss of energy, confusion, thirst, dry mouth, dark yellow urine. If you're getting into a moderate, as a guide, if you notice your gals are complaining, they just seem a little more confused. You're not going to see what their urine is like, but you can say, if it's a darker urine, or if all of a sudden you're having less dark urine, the quantity is a big deal. Even if they're trying to drink, it's become less, they have a rapid, weak pulse, they're more dizzy. That's something to keep an eye on and really focus on getting them hydrated. And then a severe case is going to have really, really dry mouth. They're having no urine output, and they start to exhibit signs and symptoms of shock. Their body is actually shutting down. So you want to kind of catch these when people are just a little thirsty, confused, that kind of stuff, saying they're a little dizzy. Stop. Let's take a break, get everyone water, maybe some electrolytes, eat a little food. We definitely want to be taking frequent breaks on our hikes and any kind of activity that we're doing, because this is something that can sneak up on you so quickly. And of course, our treatment is what we talked about before with electrolytes and hydration, oral hydration. And then to prevent it, it's suggested, if you're doing something, to drink 1/2 liter of water in the morning before you even do anything. And then of course, drinking and whatever during the day until your urine is clear. Sorry, I don't know if you guys talk about a urine as much as a nurse. We talk about all the time. It's super important. So yeah, do keep an eye on it. I think we all kind of know whereabouts we are. So keep an eye on that when you're out in the mountains, because especially in the wintertime, you're going to be drinking way less. You just tend to. And then in the summertime, if you're just running around doing stuff, you forget about it too. So we want to definitely keep an eye on that, especially this year, going into the summer and all that sort of stuff. All right, our next issue or problem, number 4, is dental problems. I haven't had any things happen on any of our trips, but who knows? This is probably going to happen. The biggest things is we'll have someone who has a filling that falls out, or you have a bad cavity. People are gonna have pain to the touch, pain with cold. The treatment for these two kind of problems, you want to rinse the area clean. I don't know who carries oil of cloves, but that is actually really awesome for tooth pain. Something we are also going to start carrying in our first aid kits is going to be called Cavit, C-A-V as in Victor, I-T, Cavit. It comes in something, it'll look like this. And you can squeeze a little bit on if someone's lost a filling, or you have an exposed gum, or just any sort of dental issue. You can squeeze that in there and you bite down on it so it keeps that bite yeah, all our dental hygienists and whatever know what I'm talking about, that bite. And then it'll dry and kind of harden in there, provide just a protection while you're out in the mountains until you can get to see a dentist. You could also make, if anyone has zinc oxide powder and eugenol oil as well, that will also make a good cavity kind of just block. Or you can also use wax. If you have candle wax or ski wax or any of that kind of stuff, you can stick that in there to protect it. Or sugarless gum in a pinch. You obviously don't want to use sugar gum. That'll make everything so much worse. But a sugarless gum, you can use all those as a temporary filling to kind of protect that area. You can also use it if someone had a dislodged crown or something. Now, there's many things that can happen with our mouth. One of them is a knocked out tooth. And if you've got that tooth, clean it off, but don't scrub it. And you can actually just put it back in. That's the safest place for it, unless someone is confused and it's a choking hazard. But generally, if they can just keep it in there, that's the best. If something has an exposed pulp, like the center core of that tooth, it can be very painful. You can take a very small piece of aspirin and put it on that and kind of chew it, and that will actually cauterize or burn the blood vessels and provide and make it a lot more comfortable for the person. You do not want to put chewed up aspirin next to just a sore tooth, because that acid in there will burn up the gums. So that's the only way to use it, is if you have an exposed pulp. Bleeding in the mouth anywhere from any sort of reason, we just treat it like regular bleeding anywhere else. So we want to apply pressure. If you have gauze or a cloth or something like that, or a finger, and you can use your finger to like hold down, or you bite it down if it's a tooth in here. Being, of course, very much aware of the airway and making sure that's not blocked. But generally that is all you'll need. You can even use a tea bag if you don't have gauze. That's very nice. And then if you've had something that's been recently bleeding, you don't want to be sucking like through a straw, like a Camelback. You don't want to do that. You don't want to chew any foods or drink hot fluids, because that's all going to reopen that clot that you've put in there. Infected teeth. Sure, some of us have had those. Swollen gums, no fun. Swollen cheek as well. A cold pack is probably the best thing for that. And then you could also, yeah, that's probably the best thing we're going to do for that. Ear problems. Number 5. Problems with our ear. We don't want to poke anything smaller, anything into our ear that's smaller than your elbow, which is actually funny. That comes a quote from our first aid book that we use. Which I think is hilarious, but it's true. You don't want to be poking a lot of things in there. If you see something in there and you just want to just grab it out, the best rule of thumb is to use fluid, like a flush water, and try and flush things out. If you can get water under pressure, like through a Camelback hose with someone pushing on the bag above it, and get some pressure in there and kind of try and flush something out, that's the best rule of thumb. Let's see, if you've got an outer ear infection, you can tell, because if you pull on the earlobe, an outer ear infection is going to hurt. So you want to just flush that ear area with a diluted vinegar or diluted alcohol. So that's something to consider having in your first aid kit. And then if it's a middle ear infection, this is not going to hurt, but they're going to seem a little, you might have some pain, but especially some dizziness and vertigo. The only thing we can really do for that is antibiotics. So they'll probably just need to head out for that. All right, now to eye problems. If you have something in your eye, it's the most miserable thing ever, and you can't function, you can't even walk. So what we try and do is we do all the things where you look and see if you can see it. Try and have clean hands or clean cloth, and try and get it out as best as you can. If it's large and it's something that's not coming out, obviously an impalement, we've talked about that in other ones, but if it's something big, what you want to do is just cover the eye and keep it from moving, and then carry the person out, especially if it's something pretty bad. And actually, if you have to evacuate someone with an eye injury, the best angle is at a 45-degree angle. There's several reasons for that, but just know that you want to keep them, you need to evacuate somebody in kind of a reclined position. If you've taken something out of somebody's eye, it may have scratched the cornea. So if something like that happens, the thing is gone and it just still feels like there's sand or something and it's awful in there. So if that is not like you've rinsed and it's not getting any better, then you can consider putting a patch on their eye for about a day or so, 24 hours or so, and hopefully it will feel a lot better. Eye infections are miserable as well. You'll notice that is something where you got redness in the eye, you've got drainage, gooiness, itchiness, a little bit different than an infection, than allergies, because you've got drainage and just nasty stuff. And so what we want to do is flush that with water. And then if you do have an antibiotic ointment, you can put it on the lower lid of the eye, like here, and you blink it a few times, and that will kind of put some antibiotic ointment over the eye. If you have eye antibiotic ointment, erythromycin is a common one. That's great, but most of us don't carry that. So anyway, that is something to consider. And you'd want to do that several times a day. Eye problems. All right, now we're on to fish hook removal. I don't know if any of you guys are fans of Alive. Alone. One of the gals got taken out because of a fish hook injury. There's several ways to get out fish hooks. They're all painful. All right, I was not going to impale myself with a fish hook to help you guys with this, so I'm going to do this as kind of a drawing, an illustration. Oh, my marker. Hey, sweetie. I'm going to grab a different marker. Hold on. Okay. So one of the ways that I'm sure you guys have heard of is if you get a fish hook in your hand or wherever, one of the painful ways, probably start with the most painful way first, is you take a scalpel, you cut where the barb is, and you pull it out, which is super not fun, especially if it's in your hand or anywhere there's tendons, vessels, all sorts of nerves or stuff like that. That is a possibility. The second option is clipping off. So if it's embedded in here, it's to continue to push it all the way through until that barb sticks up, and then cut the barb off and then pull it out that way. There's also another technique. It's called the string pull push through method. And I want to show you this. It looks to be the least painful method. And I'm going to just, let's see, take it. Actually, I think I'll show you the picture before you get my awful illustration. See if you can see this okay. I'm gonna pull this back till it's in focus. I don't know if that works. Anyway, so you have your arm here with the fish hook. What you're doing is you're pushing down on the hook, and then you also have a string tied to the base of the skin, and you've got your little barb down here, and you are pulling at the same time. So as you apply pressure, you're also pulling at the same time. I don't know if that makes sense. I've never done it myself, but if anyone wants to try it, let us know if that worked out for you. That would be great. Any of your fishing women, that would be fantastic. I probably would do number 2. I don't know, but all options sound painful. All right, next one, headaches. These are miserable. Usually the cause for headaches are one of 3 different causes. Usually it's dehydration. I always tell my kids their headaches are from dehydration. So you'll want to make sure that you've been drinking plenty of fluid. It could also just be a tension headache, which are just totally miserable. And so that would be something where you want to low light, low stimulation, calm things down a little bit. If you've been in the sun and squinting all day, make sure you have sunglasses, get in the shade, that kind of thing. Can be also caused from vascular disorders. I'm sure plenty of you guys have migraines. Those are awful. So they can have a multitude of different causes. The ones we're going to treat in the mountains will be the dehydration. So we'll want to rest somebody, make sure they get lots of fluids, maybe do some massage here, and then do some over-the-counter painkillers if you want, like a Tylenol, ibuprofen, that kind of thing. So that's probably as much as we can help as far as helping each other with our first aid kits and things like that. Nosebleeds. All right, I used to take care of little kids, and I had a kid that had a nosebleed that would always last like 10 or 15 minutes and scared me to death. But honestly, if you've got someone who's got a nosebleed, especially if it's a spontaneous nosebleed, you want to have them, it's a lean forward, Lean forward because we want to think the blood's coming out. We don't want to swallow the blood. So lean forward, squish our nose like this, and have them sit forward for 10 to 15 minutes. It can take up to that long, sometimes for those blood vessels to clot. So give them 10 to 15 minutes before you start to panic. If you need to, you can always put a cold compress up here. That will also close down the blood vessels and help a little bit with the control of blood as well. If any of you guys ever use Afrin, it's a nasal spray that can also be used. If after 10 or 15 minutes you still have some bleeding, you can kind of push it, spray that up there and see if that can help. They say, according to our first aid guide, that it should be helpful in helping stopping clotting. I haven't had to use that yet. You can also pack the nostrils with gauze soaked with an antibiotic ointment or spray, so Afrin as well. I would think if somebody is, if this is more of a traumatic injury, but if somebody had been hit and had a broken, I mean, they were bleeding badly, you can always put up tampon up the nose. You just want to be careful that you're not blocking any airflow. That's critical. So anyway, so nosebleeds, hopefully, yeah, hopefully 10, 15 minutes, you should be good to go. If something is lasting longer than that, we definitely want to consider evacuating somebody. All right, splinters, we're nearly done. Splinters are pain, and we get them all the time. Of course, it's going to be the simple stuff that you guys already know. If you can see it, pull it out, use your magnifying glass or whatever you've got. And then if you can't see it, or if you can see it, but it's deep in there, you really want to find, see if you can get a little, if you have a scalpel or a little knife or something, a tweezer edge, really dig in one end and then push things out the other end. If you really had to, you can take a scalpel or a knife and just slice down in there and get that thing out. And then you treat it like a wound. You cover it, clean it, and bandage it up. There's a rule of, there is a school of thought that if it's not bad, it's not bugging you, your body will get all nasty and irritated and get all pussy and squish it out itself anyway, which is true. So if you want to live by that, rough or la, that's fine too. You just got to be careful if it's something small. And if it gets bigger, your body is always going to hate something that's got stuck in it that it recognizes as foreign, and is going to be irritated, and it'll let you know eventually. So anyway, splinters, there you go. And then our last one is sunburns. Sunburns, of course, come in first, second, and third degrees. We've already kind of talked about burns, I believe, on another Zoom meeting. So we'll just talk about the first degree. We want to cool our skin. Aloe vera is awesome because it sucks away that heat. Cool water will do the same. Something will be similar. You can put a cool cloth on your burns, and then use a moisturizer after you've gotten the heat out. You can also take ibuprofen. Ibuprofen helps with the inflammation and the pain as well, so it's kind of a nice one. And then, of course, stay out of the sun. Second degree, if you start getting blisters, your burns cause blisters, and we want to treat that as a blister and cover it and protect it. Also, see if you can cool the area if you're able to cool it. And then that's something in our first aid guide. It says to contact a physician if you have a blistered burn. So I don't know, I'll leave that up to you. Then, of course, our prevention, we want to wear long sleeves, pants, or at least lots and lots of sunscreen. Sunscreen is good as long as it's 15 plus. So if you have a 50 and want to go for it, but honestly, as long as you're over 15 in our area, as far as I'm aware, that should be fine for you. But do use it, face, hands, everywhere. Some tip, especially in the wintertime, is to put sunscreen on the bottom of your chin and on the bottom of your nose. These are weird places, but the snow reflects. Water will do the same thing if you're spending a lot of time kayaking, canoeing, anything like that. So you also want to make sure you cover this area as well with some good sunscreen. And even on cloudy days, you've got to keep a heads up. And then hats are good. All those things. We want to have youthful skin forever. So my sister Marilyn would tell you all. So anyway, those are our common injuries. Do you guys, we'll take a minute here and let me know, do you guys have any questions or comments? If not, give me a thumbs up. Lisa knows the drill. If you're like, my brain is full, I got it all, I'm okay. Erica, you're blank, I have no idea. I feel like you're good. Awesome. Okay, and just to recap again, everything that we teach on these Zoom meetings are from the Backcountry First Aid and Extended Care book from Buck Tilton. This is a mini version that we have in every single Mountain Mama first aid kit. It should be on every single trip. So you can always, anything happens, it's got a really easy reference. And then this is an abridged version of the textbook that we used for our wilderness first responder training. And so everything that we learned, and this is the condensed version of everything we learned in wilderness first responders. So if you got everything we said today, you're amazing. You're one step closer to getting a wilderness first responder. So, all right. Well, thank you so much. We're going to end this and hold on.